My name is Mike Farquhar. I'm a consultant at Evelyn in London. I'm a paediatrician, so most of what my work is trying to help children and families with complex sleep difficulties. I've been a consultant for about 5 years, and one of the things I've tried to do since I became a consultant is, as Ian said, talk a bit more about the impact of sleep deprivation and fatigue, not just for the patients that we look after directly, but on the people who are delivering that care itself. I think that is something we are very bad about talking about within the NHS. I think we are very used to working and trying to perform to very high standards, and we're pretty bad about thinking about looking after ourselves as part of that, and I think that increasingly becomes a really big issue when we're trying to deliver care in what are becoming increasingly challenging circumstances. When I started doing this kind of piece of work, there wasn't really very many people talking about it. It was quite a difficult thing to get off the ground, to be honest. When I started doing this within our hospital, I had to argue with our medical director to get 30 minutes of time in our induction programme to talk about this, because things like hand washing and fire safety were more important. But we pushed and we got it in, and it's now become a well-established part of our induction and has gone wider than that. More than that, it is also something, my slides are going to work, that we are seeing increasingly in other ways as well. So it is starting to come through in the general medical press, so things like this on the front of the BMJ are becoming more readily seen. We are getting a bit more of a conversation about this kind of issue within healthcare. So we're beginning to get there. It has taken time, but I think we are much better on than where we were before. It means that we are starting to see editorials like this coming into the BMJ. So this is talking about the impact of sleeplessness on our modern lives and how difficult it is to prioritise sleep for all of us. And there's lots of good reasons why we find it difficult to do that. So the stresses of modern day life, anxieties, we are very bad about prioritising sleep in our lives. Sleep is absolutely fundamental to every aspect of your health. You spend about a third of your lives asleep, and every aspect of your physical and mental health depends on you getting the right amount of sleep. So things like this become a problem. Does this sound familiar? Can anyone see the problem with this quote? So this is a BMJ editorial. What's the problem with this? So this is a quote from the BMJ. This is a BMJ editorial. But the difficulty is that it's from 1895. Modern life has always been stressful. It's just as anxiety-provoking and stress-inducing in 1895 as it was now. And none of the stuff that I'm going to talk about is particularly new, none of it is particularly revolutionary, none of it is particularly new science. We are very bad about prioritising sleep in our lives, and that's been the case for a very long time. So one of the challenges about this is thinking about how we can try and persuade people to think about sleep in a more integral way to everything that they're doing. The reason I started doing this work when I became a consultant, though, there are lots of reasons why I think it's important, but this is why I started doing it. These are junior doctors who have crashed and died just trying to drive home after a night shift. These stories are not uncommon. It's not just doctors, it's anybody who works around the clock, and particularly in the kind of jobs that we're all doing. But these are people who are just trying to provide normal care within the NHS and paid the ultimate price for it. These were doctors who were working night shifts, which the Daily Record describes as gruelling, but they were gruelling to the terms of an average Daily Record reader. They were not working night shifts that were particularly out of the ordinary. They were working jobs that were European Working Time Directive compliant, they were New Deal compliant. They were not particularly unusual in the type of work they were doing or the intensity of the work they were doing. Both of these doctors died after working 3 night shifts. They died driving home after their on the fourth morning after night shifts. And one of the important things when we're thinking about sleep and fatigue and sleep deprivation is that those effects become cumulative. By the time you get to the 4th morning, having worked 3 night shifts, the quality of sleep you will have had over the preceding 72 hours is going to have been very poor, and the quantity of sleep is going to be much less than you would normally expect to get for most people. Which means by the time you get to the 4th morning, you are very vulnerable in terms of fatigue and sleep loss and sleep deprivation. When you start to think about these are very much tip of the iceberg kind of stories. How many of you are clinical? How many of you work night shifts? How many of you have felt unsafe driving home after a night shift? So we know that this is very much tip of the iceberg. When we ask people who work night shifts on a regular basis, they tell us that that is a normal experience. About half of, so this happened to be a survey of junior doctors, anaesthetists carried out last year, and about half of all of the junior anaesthetists surveyed in the country last year told us that they had felt unsafe, had a near miss driving home after a night shift. If you ask people if they felt unsafe, that goes up quite rapidly to 90-95% of people. And that is just one aspect of that. If you haven't read this survey, it's well worth looking at, because what it does is paint a picture of the impact of fatigue and sleep deprivation on every aspect of the personal and professional lives of these doctors in training. It's not unique to them. It just happens to be that this was a survey looking at doctors in training, but it applies to anyone working at night. As I said, none of this is new. Have any of you seen this document before? Yeah, so I usually get maybe one or two hands going up. This is a great document that the Royal College of Physicians produced over 10 years ago now, which did something very similar to the kind of stuff that I do today. It pulls together all the evidence about sleep, about night shift working, about fatigue, about things that individuals can do to make that better, about things that organisations can do to make that better. There's a big working group of all of the relevant organisations, all the Royal Colleges, the BMA, GMC, anyone you can think of was pulled into this. And unfortunately it was kind of published and then sank without a trace. Anaesthetists are pretty good about thinking about fatigue, and they've been publishing about the impact of fatigue on their profession for the last 15 to 20 years. And as I said, it's not just doctors. The Royal College of Nursing produced very similar recommendation and guidance shortly after the Royal College of Physicians documentation, so again about 10 years ago now, saying exactly the same things. We need to think about these aspects of the care that we deliver. But unfortunately, despite the top level work, very little of it historically has translated to meaningful changes on the ground for the people actually delivering the work. So there is a bit of a disconnect between recognising the importance of this and actually translating it into something that makes a difference. What I tend to do is boil this down to very, very simple principles, and the point of that is to try and say that these are absolutely core points. I tend to find that people find it much more difficult to challenge the simpler I make the points, and then the challenge to everybody else becomes, what are we going to do about it? So very deliberately, this is a fairly simplistic approach to sleep and fatigue in terms of how we should be thinking about it. The first part of that is this. So hands up if you think you get enough sleep. Awesome. How much sleep should you get? Do you know? So the median amount of sleep for an adult is about 7 to 8 hours. It's important that that is a median. There is a normal distribution. Some adults are able to get by on as little as 6 hours of sleep. Some adults may need as much as 10 hours of sleep. But the important thing is you should know how much sleep you should be getting. And for most people, 7 to 8 hours is going to be about the right target. How many of you get an hour less sleep than you think you should do? More than an hour less? So one of the challenges is that I know that even before I start thinking about you as healthcare professionals, I know that most adults in this country are sleep deprived. So when we do big surveys looking at the amount of sleep that adults get relative to the amount of sleep we think they should get, most adults are probably sleep deprived to the tune of about an hour per night. An hour per night doesn't sound very much, and it sounds like most of you are already dealing with that day in and day out, and you take an extra cup of coffee or whatever, you feel a bit grumpy for the beginning of the day, but you crack on and everything's fine. If you think about that in a slightly different way, if you are meant to be getting 7 to 8 hours of sleep every night, and you're missing an hour of sleep every night of your life, you are missing the equivalent of an entire night's sleep every week of your life. And for the sake of this talk, you'll just have to trust me that sleep is absolutely fundamental to your physical and mental health. If you are missing an entire night of sleep every week of your life, there are going to be consequences for that. And that is before we ask you to come and work in a stressful, pressured, high-intensity environment where you're working around the clock. So one of the core things that I have to try and deal with is that you're probably sleep deprived already, and that is probably one of the most important things to try and address in trying to make things better about how you're able to work in this type of environment. Second question, hands up if you drive. Keep your hands up if you'd be happy to drive if you'd had a pint of beer or 2 glasses of wine. Nobody. Some people slightly more hesitant to put their hands down. That's the normal response. So most people put their hands down and say they're not happy to drive. Why are you not happy to drive? Very few people are drunk if they have had a pint of beer or 2 glasses of wine. So why do you put your hands down? Safe, absolutely. Yeah. So we have done an awful lot of work over the last 20, 30 years to say that even small amounts of alcohol are enough to affect our driving responses, our reaction times, to significantly increase our chances of having a major road traffic accident. And we've kind of got to the point where most people will put their hands down at the thought of even a little bit of alcohol. When I was a kid, this was the kind of attitude that was around about drink driving. As long as you'd had not too much to drink, so 2 or 3 pints is probably fine. As long as it's not 4 or 5, you're probably all right to drive. That's the attitude I remember when I was a kid with my dad and my uncles and everybody did it. It was normal in the 80s. Where we have got to now, though, is this kind of attitude, where we say that for most people, it's a zero tolerance attitude to alcohol. Any alcohol on board significantly increases your risk. You are more likely to crash, you are more likely to be injured, you're more likely to die. How long do you need to be awake for before your reaction time is the same as if you're at the legal drink drive limit? It's about 16 to 18 hours on average, and that is assuming that you have had the right amount of good quality sleep in the preceding days and nights before that. If you are chronically sleep deprived, you are likely to get to this point before 16 to 18 hours. If you were on morning 4 after 3 night shifts, you are very definitely going to get to this point before 16 to 18 hours. There's very good evidence that tells us that even mild to moderate sleep deprivation affects your cognitive functioning, and in this case your reaction time, to the equivalent degree as if you're at the legal drink drive limit. And I'd be willing to bet that all of you who put your hands down saying, of course I wouldn't get behind the wheel of a car having had a pint of beer, you wouldn't hesitate to get behind the wheel of a car if you had been awake for the functional equivalent of 16 to 18 hours. Fair? So one of the really important points about this is we need to do that piece of work that took 20 years to change culture about drink driving. We need to approach fatigue in the same way. The physiology is the same. Your impairment is the same, your risk of a road traffic accident is the same. And in exactly the same way that we don't tolerate alcohol when we're thinking about driving, we need to get to a point where we're thinking about fatigue in the same way. So driving tired is like driving drunk. Depends a little bit on which drink driving limits you look at and exactly your own individual tolerance for fatigue and tiredness where you get to with that. But the principle is absolutely valid. The next thing that's really important about this is that for those of you who work around the clock, so within the NHS we have to provide 24-hour care, 7 days a week, 365 days a year. You have to work around the clock to provide care. We expect you to provide care to the same standard at 3 o'clock in the morning as we do at 10 o'clock in the day. The difficulty with that is that involves working against your body clock. So have you ever been jet lagged? So when you are jet lagged, you travel to the other side of the world, you're in Sydney, it's all great, but for the first few days, your brain is telling you it's midday and the world is telling you it's midnight and vice versa. You tend to be sleepy when you should be awake, you tend to feel awake when you should be sleepy. We get physical symptoms when we're jet lagged. We feel achy, we feel nauseous, we get mental symptoms, we feel sluggish, we feel irritable, short-tempered, it takes us longer to do things. Jet lag for most people is not pleasant. It is the consequence of working against your body clock. Your body clock, your circadian rhythm, is one of the strongest drives there is in your body. It's trying to keep you awake at this time of the day, hopefully, and asleep through the night time. And when you try and act against that, there will be consequences. If we sent you off to Sydney to go and start new jobs, we wouldn't expect you to get off the plane and go into an operating theatre or an emergency department or intensive care unit and start working day one. We would anticipate you would need a few days to acclimatise and adjust because you're going to be jet lagged. That's very reasonable, very common sense. But when we ask you to work a night shift, we are asking you to do exactly the same thing. We are asking you to function as if it is day at night time, and every cell in your brain and body is screaming at you that you should be asleep, and you are trying to function at your best. You are evolved to be asleep at 3 o'clock in the morning, nothing else. And we need to acknowledge that when we ask you to work at night, it is like asking you to work when jet lagged. We're never going to get to a point where, and I don't think people would want 4 or 5 days to acclimatise in and out of night shift and adjust their body clocks. But as organisations, we should be acknowledging that when we are looking at staff working through the night, there is a physiological consequence and a physiological impact on their ability to perform through pure, simple physiology. Increasingly, the more that we understand about sleep, the more that we understand that even mild to moderate sleep deprivation is a significant risk factor for health. As I said, most of you are going to be mild to moderately sleep deprived. For all of you, hands up if you will sleep later at the weekend when you don't have to wake up with an alarm, more than an hour later than your normal wake-up time. So that's something called social jet lag. It tells you that you're sleep deprived. It is the single strongest factor, or sign rather, of the risk that you are posing from sleep deprivation. If you are socially jet lagged, your lifetime risk of cardiovascular disease goes up. You are much more likely to get hypertension, stroke, heart attacks. your risk of obesity goes up, your risk of type 2 diabetes goes up. Increasingly, we're understanding over the last 12 to 18 months that if you are deprived of dream sleep, which is what people who are chronically sleep deprived tend to be, your lifetime risk of Alzheimer's disease significantly goes up. Sleep deprivation has consequences. And when we look at the consequences on you in particular, the people who work shifts and the people who work around the clock, there is a growing body of evidence that tells us that there is an even bigger impact for your health. This is a really nice review from the BMJ from a couple of years ago that's well worth reading. What it boils down to is this: shift work is bad for you. If you work shifts, it increases your risk of health problems. It will probably cause you to die younger than you would if you didn't work shifts. In exactly the same way that something like smoking, if you smoke and you stop smoking, it takes a period of time for your risk to settle back to the background average. If you work shifts and you stop, there isn't a lot of evidence looking at this as yet, but the evidence that is there suggests that for most people, it probably takes about 5 years after you stop working shifts for your increased risk of health problems to drop back to the population average. This paper is worth reading if you're a healthcare professional working around the clock. More importantly, I think this needs to be on the horizon of everybody who asks people to work at night. If you're a manager, if you're a human resources department, you must be aware of what you are asking people to do when you're asking them to work around the clock, and we must be thinking about how we can minimize that impact as much as we possibly can. One of the other things about fatigue is that it has consequences in ways that you might not immediately be aware of. Gillian Pick is a nurse in the west of Scotland in Ayr Hospital. She was convicted of dangerous driving in January last year because she had worked a 13-hour night shift, middle of winter, very busy, lots of patients to see. It was more important that she kept working. She kept looking after her patients. She didn't take her breaks. She got through to the end of the shift. She had to get from hospital to home to pick up her kids to take them to special needs school. In the process of doing that, she crashed her car into somebody else. Nobody was killed, nobody was injured, but both cars were significantly damaged. And she ended up in front of a judge. And the judge said to her, "You're a hero. I have nothing but admiration for you. You are somebody who is giving from yourself. You are giving to your patients. You're giving to your family. You are not thinking about yourself. You're thinking about the people around you. I have nothing but admiration for you. But you were somebody who should not have got behind the wheel of a car, and you knew that you shouldn't have. You knew you were tired. You knew you shouldn't have done that. I have no option but to find you guilty of dangerous driving." She was convicted and she lost her license. Fatigue is not an excuse in law. One of the doctors who died from the first slide, Dr. Ronak Patel, was an anaesthetic registrar who had experience in working night shifts. He'd been rotated an hour away from his normal hospital, so he had an hour commute to and from work on top of his 12-hour night shift. When he finished his night shift, he rang his wife and said, "I'm really tired. I need to get home though, so I've had some coffee, I've wound down the window. Can you talk to me? Can you sing to me? Can you keep me awake as I'm driving home?" And on the way home, everything went quiet. And when his wife tracked back to find out what had happened, he crashed and died. I have absolutely no doubt that if he had crashed and killed somebody else, he would have been found guilty of manslaughter, because he had clearly demonstrated that he knew he was too tired to safely drive and he chose to drive anyway. And the law will not protect you. The law assumes that anybody who falls asleep behind the wheel of a car will have known that they were too tired to safely drive, and you will be held accountable for your actions if you do something when you are tired. The other side of this is that it affects patient care. So all of this kind of stuff about how it impacts on you is absolutely important, but it also impacts on the reason you're there in the first place. This is a really simple experiment done with intensive care registrars in the paediatric intensive care unit in Southampton, where they're given a risk assessment exercise. They're given a button to press. The more they press the button, the bigger the balloon gets. The bigger the balloon gets without popping, the more money they get. But the bigger the balloon gets, the more likely it is to pop. So it's a risk assessment exercise. They do this at the beginning of a night shift and the end of a night shift. What changes at the end of the night shift? More balloons pop, absolutely, which is fairly readily apparent. Fatigue makes you take more risks. When you are tired, you are less able to assess risk, and you are more likely to make riskier decisions when you are tired. What didn't change? They were just as confident making the more unsafe decisions as they were making the safe decisions at the beginning of the night shift. Because one of the other things that is impaired when you are fatigued and sleep deprived, even a little bit, is that sense of insight into how impaired you are. You lose the ability to realise how much fatigue is affecting you when you are fatigued. And with that lack of insight comes a degree of unsafety, because you are going to be making riskier decisions without being aware that that's what you're doing. It means that when these doctors are called to resus at 7:30 in the morning to resus the baby that's been called in as a cot death or the kid in status, that they are going to make riskier assessments and riskier judgments than if they weren't fatigued. It means when they finish their shift and they're thinking to themselves, am I safe to drive home? They're going to say they are, because their ability to assess that risk is in itself impaired. And we know that you can look at any cognitive measure you want to look at, and even mild to moderate sleep deprivation and fatigue will begin to impact that. And this is also from that BMJ paper, if you want to look at this in more detail. The other really important thing from a cognitive point of view that I think we absolutely have to acknowledge is that one of the other things that becomes very quickly impaired when we are sleep deprived and fatigued is our sense of empathy. And within the NHS, I think if we are not thinking about our ability to function as empathic people when we are trying to deliver healthcare, then something has gone wrong. At 3 o'clock in the morning, when you are tired and you don't want to be at work at all, your brain's telling you should be asleep, your ability to understand how the person you are trying to help is feeling and react appropriately is impaired. That has to be fundamental to the care that we are aiming to deliver. The GMC are beginning to take an interest in this and saying that this is something that impacts on the care that we deliver. A slightly terrifying statistic from my point of view, the GMC does an annual survey every year of junior doctors and the consultants that train them. One of the questions they asked last year was, how regularly do you feel tired in the daytime to the extent that it affects the care that you deliver? 20% of doctors answered yes to that, and that's in the daytime. So this is fundamental. Fatigue is hiding away at the heart of the NHS, and we've ignored it for a very long time. One of the difficulties with that, though, is that we kind of tell you that you're all amazing, and you are. You're all doing amazing things, often in very difficult circumstances. You rise to huge pressures that are out there. You deliver again and again and again. We're short-staffed, we're under-resourced, it's getting tougher out there every day, and yet you lot manage to step up and keep delivering the care. And you get told that you're amazing and you're superhuman. You are amazing, but you're not superhuman. Your physiology is absolutely, boringly, humanly normal. And the more that we tell you that you are superhuman, the more that we expect you to keep living up to those standards, and they are unachievable. You put a huge amount of pressure on yourselves to deliver that is reinforced by this attitude that we tell you that you are more than the average person. So the snow a few months back, everybody that managed to struggle through the snow to get to work was told they were amazing superheroes keeping the NHS going. This kind of idea that we reinforce the idea that we expect you to be better all the time is really damaging. So one of the things that we have to do is break that down and say you're not superhuman. We have to treat you in exactly the same way we would treat everybody else. We have to acknowledge that your physiology is normal and adjust for that and account for it as we can. A lot of what I talk about ends up boiling down to this. There are lots of things that I think people can and should do to try and think about offsetting the impacts of fatigue and sleep deprivation. But fundamentally, this is one of the most important points. We have forgotten within the NHS that the reason that breaks are there is not because they are nice for us to have. They are, but that is not the most important reason they are there. They are there because without regular breaks and regular rest, you are not able to function anywhere near the standard that we think you should be. The driving code tells people they should not drive for longer than 2 hours without stopping to take a 15-minute break, because all the evidence tells us that it's difficult to sustain performance on a task like driving for longer than 2 hours without our performance beginning to be impaired. Breaks are there to protect our patients first and foremost, and that is something that we've very much lost sight of, particularly as the pressure increases. Other organisations think about this a bit better. Gatwick closed its runway a few Sundays back because there were meant to be 3 air traffic controllers on duty. 2 of them were sick. One guy left trying to man the airport, and the airport authorities took the decision that the only safe course of option was to make sure that he got his breaks, because an air traffic controller trying to land planes when he's fatigued is a recipe for disaster. So they shut the runway. 3 or 4 times through the course of the day, they shut the runway, they rediverted flights, they cancelled some. People were pissed off, they ended up in Stansted instead of Gatwick, or their flight was delayed. But they said that was the absolute minimum that they could do to make sure that there was no increased risk to safety. Things like the rail industry, so the Croydon trams have had a couple of crashes in the last couple of years, and they've all been related to driver fatigue and driver sleep deprivation. Rail industries tend to be much better than we are about thinking about the impact on their staff of these, and they have much stricter rules and regulations about what is acceptable. Even such hardcore organisations such as the US Navy are beginning to accept that they have to think about fatigue better. The US Navy for a long time has operated a watch pattern of 4 hours on, 4 hours off, 4 hours on, 4 hours off. They're beginning to realise that that is causing their staff to be fatigued and sleep deprived, because in the last 2 years they've managed to crash their ships on an embarrassingly large number of occasions. And it all boils down to the people piloting the ships are just too tired. So fatigue impacts, and other organisations are better than us about thinking about this. The classic one is air safety. I think the comparison to airlines and medicine is always a little bit fraught about how far you can take it. But from this point of view, I think it is worth thinking about how the airline industry approaches this. You don't want tired pilots in the cockpit. The modern planes that are doing the long haul flights, the equivalent of a night shift, the 12 to 13 hour flights, they all have spaces that you never see. So passenger cabin down here, but up above that is the crew cabin, where the crew are able to take regular rest and breaks during those flights. And fundamentally, those are spaces where these people can sleep. And that's because the airlines know that not just the regular breaks are important, but if they are able to sleep during their shift, they offset some of the risks of fatigue and sleep deprivation. The airlines are not doing this because they're being nice to their staff. The airlines are doing this because they think this is the minimum, least expensive way that they can get away with providing a safe service that they're not going to get sued for. So that's why they're doing this. This is the absolute minimum amount that they think they can get away with in terms of looking after their staff in terms of rest and fatigue. It still doesn't work, so particularly on the short haul flights within Europe. So one of the budget airlines recently has changed their pilots off-duty rotas effectively. That ends up with them being fatigued. And you still get stories like this. This is from a couple of years ago. This is a UK-based airline charter holiday type flight. Both pilots asleep in the cockpit. We don't want that kind of situation. But it still happens even in industries like the airline industry, which thinks about this a lot better than we do. So the idea that the airline industry has to wake up to this is very much enshrined, but we don't apply those principles in the same way. And it comes down to this. You all know this. If you are tired in healthcare, you're more likely to make mistakes. And we should be thinking about things that we can do to reduce risks of mistakes, and this is a really key element in that. So I think this is something we should be stopping and doing something about. So the practical question then becomes, what can we do about it? For the last 5 years, within the Children's Hospital at Evelina, we have built teaching on this into our core induction. As I said, it was a bit of an argument to get it in there. Initially I was given a relatively short slot, and actually the feedback from the people who had that said, you know what, this is the first time at induction we've ever had any teaching that feels like it's about us and not about hand washing and fire control and safe handling and all the rest of it. This actually feels like somebody trying to do something to help us work better. And what I give them is, in the space of an hour, the basics of sleep physiology so they can understand why what I'm talking about is important. And I focus on things that try to make things a bit easier for them. The first bit of that is that point at the beginning. You're all sleep deprived. So one of the first things I try and do is persuade them to think about how they can change their core sleep routines and habits to try and make that better. Some of that's really simple stuff. Things like how good your bedroom is for sleep can make a really big difference to sleep. Your bedroom needs to be cool, dark, quiet and comfortable, and all of those things can be challenging at the best of times. So we are coming into, I'm sure Milton Keynes is not that much different to London over the next few months. So the last few summers in London, bedroom temperatures have hit 30 degrees at night. Your bedroom needs to be about 17 to 18 degrees to sleep comfortably. So even something as simple as the temperature in the room can make a difference. That all becomes even more challenging if you're a night shift worker trying to sleep in the daytime. So simple things like making sure you've got a comfortable bed, that you've thought about how to control temperature, that you've invested in blackout blinds or eye masks or earplugs, things that can try and optimise the quality of the environment that you're in to get the best quality sleep are important. I spend a bit of time talking to them about this. Hands up if this is the last thing you see before you go to bed, your phone. Don't be shy, because almost everybody will, so you might as well. So I talk to them about things that are good and bad for sleep. Phones, I'm afraid, are really bad for sleep. Great things, But if you are on your phone in the last hour before sleep, for lots of reasons that I'm not going to go into just now, your sleep quality is going to be affected. So I talk to them about the things that they are doing that are good for sleep and bad for sleep, and try and teach them how to do that better. I talk them through the night shift. There are things that you can do to work better at night. There is no good way to work at night, there are only less bad ways to work at night. So we talk to them about strategies that they can put in place. Some of them are things like using caffeine. There are sensible ways to use caffeine through a night shift, and then there are bad ways to use caffeine through a night shift. One of the key recommendations is exactly the same as the pilots. If you are working a night shift in a hospital, if you were able to take a short power nap during one of your statutory breaks, and we're talking about a 15 to 20 minute nap, nothing longer than that, there is good evidence for many people that that will offset fatigue and the impact of sleep deprivation, help you to feel better, help you to function better, help you to improve the care that you're delivering to your patients, and reduce some of those risks in terms of things like getting home safely afterwards. So there are lots of hints and tips that we can give people to try and help them to work better through the night. We talk to them about getting home. One of the most important things about getting home is if you were too tired to drive, you should not. Junior doctors are now protected by the new junior doctor contract, which tells them that if they say they are too tired to drive home after a night shift, their employer is legally obliged to either provide them somewhere safe and appropriate, so a proper bedroom to sleep until they're safe to drive home, or if that's not possible, to make alternative arrangements to get them home safely. Junior doctors are not special in this regard, but they are legally protected by the contract, where other members of staff are not. Good trusts apply that principle to every member of staff. So any member of staff in our trust, if they get to that point, can come up to the senior nurses at the end of the shift and say, too tired to get home, what are we going to do about it? And they will try and make out a solution to that. Paul is there because if you are getting home at this time of day, a lovely day like today, if you just finish a night shift and you go out into the sun like this, that bright light is going to tell your brain that you're meant to be awake. It reinforces the fact that this is an awake time for that. So sunglasses help to reduce the impact of that. And again, there are lots of simple hints and tips that you can do to try and optimise getting home and the quality of sleep that you get when you get there. I then talk to them about recovery, because lots of people within hospitals these days are on shift patterns where you'll finish nights on a Monday morning and be expected back to do a day shift on Wednesday morning, which means you have to be very, very good at flipping your body clock back again into a daytime routine. The absolute physiological minimum for most people to do that is 2 nights. Which means if you are coming back to work on Wednesday morning, you have to be really good at doing this, because otherwise you're not going to be in the best possible state when you come back on Wednesday. So we talk to them about how they can do that. We've done this teaching with the trainees, the paediatric trainees within London for the last few years. We've surveyed them, and what they have come back and told us is that with just that, an hour of teaching about sleep, about shift work, about how to do these things better, 3/4 of them tell us that they have made a change to either their core sleep or how they work at night that they say has made working at night better for them. So something as simple as building teaching like this into induction can make a difference that people appreciate and feel like it makes a difference. Those recommendations, if you want them, are summarised. This is an article I wrote for the Paediatric Journal, but it applies to anyone working at night. So the first bit is all about core sleep, then there's a bit about working through the night, and the bit that I'll come on to just now, there's also a bit at the end of it about things that organisations can do to try and help with that. One of the difficulties, though, is that this ties into this idea of burnout and resilience. And this kind of teaching is resilience teaching. This is about trying to teach people how to cope better with working in what is one of the most demanding jobs there is to do. You're working at the extremes of human emotion and experience, and there should be no shame in teaching people how to try and cope with that better. But one of the difficulties with that is that if we just try and say to you that the way to cope with all of the pressure out there is just for you lot to do whatever you're doing better, then that doesn't work. If the difficulty is that there are systemic problems, then we also have to address those in parallel. And many people write about resilience and say that if we over-focus on resilience and ignore the fact that there are systemic issues, then all that people end up doing is being annoyed and upset and frustrated about the fact that they feel they're being told they're not doing things well enough, and it's their fault that things aren't going well. So resilience is part of a solution, but it's only ever part of the solution. And we also have to look at the systemic factors that tie into this as well. That involves trying to change culture in the NHS, and trying to change culture in the NHS is a bit like this. There are lots of things I think we can try and do better, but lots of people react negatively to being told that they should be trying to do things better. So when we do the surveys of our junior doctors, we ask them about that experience of sleeping at night in particular. And what they tell us is that many of them are working in hospitals where if they're caught sleeping on night shift, they will be punished or penalised. And that attitude is widely prevalent in the NHS still. So there's this idea there is a culture of fear amongst staff who sleep at night, and we need to break that down. Any trust that bans sleeping of their staff on night shift is a trust that fundamentally does not understand basic circadian physiology. That is a sign of ignorance if they are banning that, and that is something that needs to be challenged and broken down and made better. Within London, again, we focused on this, so we've gone around departments and said who supports power naps. When I started doing this work, 15% of departments did. We're up to 48%. We still have a long way to go, but I think I'm happy that we are making progress. It takes time to break down these cultures and change things. Within Guy's and St Thomas's, we have presented this kind of data to our senior exec, and just over a year ago they responded to that by saying, right, we're going to focus on what we think is the most important element of that, which is that at Guy's and St Thomas's we pride ourselves on being a trust that will deliver the highest quality of care to our patients, but we can only do that if we look after our staff. So the campaign that we introduced was this idea called Halt, Take a Break, which was to try and encourage people to remember that looking after yourself and taking a break is something we expect you to do to be able to deliver care. If you are not getting a break, you are not providing care to safe standards. So we did a lot of work about trying to do that. We specifically focused on our medical registrars because they're often the people that are most under pressure with this. And we gave them some specific teaching. We renovated their mess. We put in linen supplies to the mess to try and encourage the idea they should be sleeping at night. But we tried to change cultures. It's not perfect. Not everybody in Guy's and St Thomas's suddenly gets every break they're entitled to, but we're beginning to challenge the culture. The culture is also challengeable by the new junior doctor contract. So for all the pros and cons, the arguments and controversies about it, one of the fundamental points about the junior doctor contract is for the first time it clearly makes this statement that working hours, breaks and rest periods of junior doctors are fundamental to patient safety. So what the contract tells us is that if we are not thinking about this, we are not delivering safe patient care. And that principle is something we should be coming back to and using the provisions within the junior doctor contract as a lever for change around about these things. Other organisations are beginning to do bits of work around this. So the anaesthetists took the death of Dr. Patel very seriously. They have commissioned a lot of work over the last 2 years about doing this. And anaesthetic departments across the country are beginning to really drill in and focus on this. So they're doing lots of education about detecting fatigue, about educating and looking at prevention around it. They've got resources which are on these web pages. The key thing that anaesthetic departments are going to do, they're a bit scarier than paediatricians, anaesthetists in general, they're going to start traffic light rating anaesthetic departments in hospitals up and down the country on both their culture around about fatigue, but also the facilities that they provide. And this, I hope, will be another driver for change. We're feeding back this type of feedback to hospitals and saying, you could and should be doing this better. The BMA took a little while to come on board, but they published a nice report on fatigue earlier this year, and they have also put together resources to try and help people to do this. I hope that's kind of persuaded you that this is something that I think we should be talking about. I think there are lots of reasons and lots of ways that fatigue impacts our care. I can literally talk about this for hours, but I'm going to shut up now. I think for a hospital like this, the key areas of focus are trying to think about what can you do to make small changes that begin to change from where you are now, which I think is probably better than many places from speaking to you a second ago, and how to make that better. And the key areas that I usually encourage people to focus on are building this type of teaching into your induction programs. And then the second bit is that idea of thinking about what is the culture to breaks and rest within this organisation and how can that be better, either improved or supported. I do a lot of talking about this on social media, so if any of you are on Twitter, I never shut up on there either. At the top of my Twitter feed, there is a kind of pinned tweet that has resources that can be used if you want to build a 30-minute induction session on this. There are resources pinned there that can help you to do that. And that's a summary to some of the key resources that we use in trying to do this.